Good day, global citizens. Welcome to another episode of Dr. Fadimbola's Opinion. On today's episode, I have another researcher, another doctor, a female who I'm glad to bring on board. Join me to welcome Dr. Sumaya Al-Mansur. Dr. Sumaya, how are you doing today?
I'm fine, thank you. And thank you for having me on your platform.
I've first-hand experience as someone who has used NHIS. So, and I must confess, before I even go to the tweet, I must confess, when I was reading the paper, maybe because I had experience, or maybe because I worked as a doctor with NHIS patients, it was hard getting questions. Like, I was trying to simplify it, like other papers. I would get like questions in a way that when we finish discussing, you might not need to read the paper, you understand what the researcher is saying, but for yours, like, it's already simplified. So this is telling our audience ahead, please read the paper. Like, it's so easy, like it's so simplified. Like, I didn't find complex terms to say that, okay, let me say she should simplify this, or let me say she should discuss this. Like, it was lengthy a bit, but the use of words, it was very simple, very easy to understand. So I had to like put micro, okay, let me get something for her to be able to say on NHIS. Thank you.
That question. And I think, first of all, I'll say I didn't move from medicine. I'm still in medicine.
Okay.
Yeah, so I think we all trained and worked as clinicians. And one thing I think across most doctors, 90% is we truly loved the patient interaction. So we're sitting with someone, we're listening to their fears, we're reassuring them, we're trying
Making process with us. That's very inspiring. Actually, public health is a subset of medicine, and one funny thing is when I did public health in medical school, I didn't see myself doing public health or even investing my time in public
Oh,
health after
nice.
medical school. But you know, the say God plans and is the best planner. So that's one aspect of my career I'm really pushing for, and I'm glad more people are going into, more doctors are going into it, and I believe with this we'll be able to improve the healthcare, not just in the global north but also the global south. The paper, I got that only 5% of Nigeria, which is very surprising, very shocking. Only 5% of Nigeria's population has health insurance, and the vast majority still pay for medical care out of their pockets. Dr. Sumeya, what factors contribute to this?
Yeah. So I think when we're even throwing about numbers and we're saying in percentage, it doesn't show how bad it is. So when you say we're over 200 million Nigerians and only 5%, that's more than 190 million, if my math is right, are paying cash out of pocket, right? So you're talking
For shedding more light on why we have enrollment of NHIS in Nigeria. What is the difference? Because NHIS is what Nigerians know. And across the paper, I came across NHIA. What is the difference between NHIS and NHIA?
Okay. So I think let's roll back to NHIS, which is the first, you mentioned it was launched in 2005.
As we've seen from one of the tweets, the reduced mobility and mortality in Nigeria, which improve health system and which will also improve, increase our lifespan as citizens. I'm optimistic.
Yeah.
Okay, Dr. Smeya, with regards to the paper, what are three things you want Nigerians to know about NHIS? Like,
So I think the
are all trying to balance the health system in every country. And I believe with NHIA on board, we'll have better results for Nigerians. From the paper, Dr. Sumeya, can you please shed more light on this sentence? Fatalistic beliefs impaired quality healthcare in Nigeria. What were you trying to say?
Okay, so first of all, what's fatalism? So fatalism is just an idea that health outcomes are determined by faith or God's will to save costs. That creates that perception of poor management. But the truth is NHIA, NHIS sets their own service standards To the level of compliance, that is a story for another day. But then there is like a level of service standards that are set, and hospitals are required to treat all patients equally, definitely. So if people should face, I think in